The following program presents principles designed to promote good health and is not intended to take the place of personalized professional care. The opinions and ideas expressed are those of the speaker. Viewers are encouraged to draw their own conclusions about the information presented.
Welcome to Wonderfully Made. Our topic today, coronary artery disease. Hello, my name is Dr. Christine Salter. I'm a board-certified family physician, and I'm the medical director of Vibrant Health Family Medicine in St. Louis, Missouri. Coronary artery disease. Why is this so important? It's the #1 killer in the United States, affecting over 500,000 people annually. What are the risk factors for coronary artery disease? First of all, I want to establish that there are conditions called coronary equivalents. They are not risk factors. They are, that if you have these, you are assumed to have coronary artery disease. What are those? Diabetes mellitus and chronic renal disease. If you have either of these, you are considered as somebody who's already had a heart attack. But if you do not have these, what are those risk factors? Physical inactivity, that's a risk factor for heart disease. High cholesterol, that is also a risk factor for heart disease. The male gender is a risk factor, although women are also dying of heart disease, and in fact more women greater than the age of 65 are dying from heart disease. So we have high cholesterol, we have physical inactivity, we have the male gender, and then cigarette smoking, a big risk factor for heart disease. In fact, a recent study showed that tobacco smoking was the #1 risk factor for the cause not only of heart disease, but also of stroke. So it is important that you as an individual assess your risk for coronary artery disease. And how are you going to do that? You need to see your physician so that he can or she can look at these particular risk factors. An additional risk factor that I did not mention initially is also high blood pressure. So we want you to go to your physician, and your physician will take your blood pressure. Is it greater than 140/90? We want to know that. Or do you already have established high blood pressure and are taking medicine for this? That is a risk factor. Your physician will also draw some blood to check your cholesterol levels. Now, you need to be fasting when you do this blood test. And that's a 12-hour fast, nothing to eat after midnight, and get the test done before breakfast. 12 hours of fasting, and we'll assess your total cholesterol, your good cholesterol, otherwise known as HDL. You can remember the H by saying happy cholesterol. That's the HDL. We'll also look at your bad cholesterol, otherwise known as LDL cholesterol or lethal. That's a good way to remember that. Happy for HDL, lethal for LDL. We'll also check your triglyceride levels. This will give an entire profile that will contribute to your risk for coronary artery disease. So your physician will check your blood pressure, do a blood test. We'll also assess a fasting blood glucose to see if you're diabetic. Again, if you are diabetic, we'll assume that you already have coronary artery disease and will automatically advance you to the high-risk category. Your physician will also assess your level of activity. Are you sedentary, or do you have an active lifestyle? What else will your physician do? Your physician will take your weight and check your height. The measurements of these two together with a certain calculation will give us a body mass index and determine whether you are overweight or whether you're obese. The ideal body mass index is between 21 and 23. If it's greater than 25, we say you are overweight. If it is greater than 30, then we say you are obese. Overweight and obesity both contribute to coronary artery disease. So these are the things that your physician will do for you to assess your risk, and also will find out whether you are smoking or not. So ideally, you should not be smoking. You should have a body mass index of, let's say, 22. You should be exercising at least 30 minutes a day. You should not be diabetic. You should not have high blood pressure. And the gender, male or female, they both are dying of heart disease, so we won't say anything about either one of those. The other risk factor that your physician will find out is, do you have a family history of coronary artery disease or premature death from coronary artery disease? So did your father, mother, brother or sister die of a heart attack before age 50? That would put you at risk for a coronary event. What do I mean by a coronary event? Let's consider the blood vessels of the heart. The blood vessels feed the heart during the stage of diastole, when the heart is relaxing. After it's pumped blood out into the major circulation, it relaxes, and during that time, the coronary vessels are fed. The coronary vessels bring oxygen, glucose, and nutrients to the heart muscle, enabling it to continue to pump. These vessels are fairly thin, and if you looked at the lining, it's very smooth. If you can imagine going down a slide, if you go down a slide and you just slide so freely and smoothly, that's the way it should be in the coronary vessels. But imagine if there was dirt and debris on that slide, and as you come down the slide, you're going to hitch. You're going to stop. You're not going to be able to go through so smoothly. That's the problem with coronary artery disease. That nice smooth vessel now becomes irregular and rough. We call that endothelial dysfunction. The endothelium is a thin lining, the inner lining of the blood vessel, that allows the blood to flow by smoothly and unimpeded. So if you have high cholesterol, and worse still, if you have LDL cholesterol that's elevated, and if it's of the type what we call the small dense type, that small dense type likes to go and line those coronary vessels. As it lines those vessels, it damages that nice, thin, delicate endothelium. What is the body's response to that? Well, whenever there's an area of damage in the body sends platelets, little cells, little blood cells that will go and patch up the area. We see this when you cut yourself. When you cut yourself, you bleed for a little bit, and then you'll notice that the bleeding stops, and that is because the platelets are coming and they're aggregating and they're clumping together to prevent any further bleeding. Well, that's what happens on the inside of the coronary vessels. The LDL, or that lethal cholesterol, causes damage to that nice thin endothelial lining. It becomes oxidized, and then in so doing damages the lining, and the platelets come rushing to the area to try and wall it off and prevent any further damage. But let's say that area is what's called the LAD, the left anterior descending artery, that supplies a large area of the heart. And we have that kind of damage going on. Well, those platelets will go to that area and form a clot, trying to wall off the area, but in so doing, it blocks off the entire vessel, and there's no more blood flow going to that area of the heart muscle. We call that ischemia. If it's completely blocked off, we say that the person has a heart attack. There is death of the myocardium or the heart muscle, and the person may die on the spot. It is unfortunate that for some people, their first symptom of coronary artery disease is sudden death. Other people have different symptoms, and we would like to talk about those symptoms now. Symptoms such as chest pain. Chest pain when you're running up a flight of stairs. Chest pain when you're coughing. Chest pain when you're eating. What is the common denominator of those three activities? The heart is having to work harder. It's having to work harder, and if there's an area of clot buildup or plaque, the blood is not going to be able to get through as well, and so it's going to be manifested as some chest discomfort. Sometimes it may be manifested as discomfort in the jaw, or it may be manifested as pain in the arm. Most people think of the left arm as the area of pain, but I've seen patients where they're presented with pain in the right shoulder or the right arm. The point is, chest pain or discomfort, jaw pain, arm pain is occurring with exertion. That is considered ischemia until proven otherwise. So, sudden death, chest pain can be manifestation of coronary artery disease. So, the signs and symptoms we say can be asymptomatic or they can be symptomatic. We want to try and find people when they are in the asymptomatic stage of coronary artery disease, or better still, determine what their risk factors are before they even develop heart disease. But how are we to do that? We need you to go and see your physician so your physician can assess your risk. It is important to find out about your family history and other lifestyle factors and disease factors to know where you are in risk stratification. Once we know what your risk is, then we can be aggressive in your management. And so, what can we do to lower your risk for heart disease, coronary artery disease? Well, it's the same story, just a different song. Recent guidelines showed that the majority of heart disease is due to tobacco smoking, physical inactivity, and poor diet. It's the same story, just a different song. Lack of physical activity, tobacco smoking, and poor diet. Tobacco smoking. If you are a smoker and you quit smoking right now, you would decrease your risk of a coronary event by at least 50%. Why? Let's think again about that endothelial lining. That endothelial lining, when it has the cholesterol plaque buildup, can become unstable. Tobacco smoke contributes to that. It makes it unstable. It makes it inflammatory, sticky. You've seen you've cut yourself sometimes and you've seen the blood oozing, and then you get a crust and it's all kind of gooey and sticky. That's what happens with the endothelial lining. The tobacco smoke makes it sticky. The high cholesterol makes it sticky. The diabetic state with all that sugar floating in the bloodstream makes it sticky. So if you quit smoking right now and never smoke another cigarette again, you will significantly decrease your risk for a coronary event. What else can you do? Get up and move. Become active. The Institute of Medicine recommends at least 30 minutes of moderate intensity exercise, optimally up to 60 minutes on most days of the week. And so, quit smoking, start moving. Now, if you've been a couch potato for the last 10 years, we do not want you to jump up and run out there and start exercising for 60 minutes. No, if you are greater than age 40, it's important that you do go to see your physician, as I said earlier, assess your risk, determine if you're having any symptoms of coronary artery disease, the chest pain, the jaw pain. Your physician may then order something like a stress echocardiogram to determine if they really put your heart under stress, does it show any evidence of ischemia? But we will always want you to start low and go slow, but do something every day. Start low, go slow, but do something every day. Plan when you will exercise. If you're just saying to yourself, oh, I think I should exercise 30 to 60 minutes a day, and then just try and work it in somewhere, it's probably not going to happen. We want you to look at your schedule in the same way that you plan when you're going to eat and when you go to bed, when you're going to go to the store and do shopping. We also want you to plan when you will exercise. It takes about 30 days to build a habit, and so it would be better if you spent those days exercising for 5 minutes every day. At the same time, build that habit, and then thereafter you may add more minutes until you reach your goal of 30 to 60 minutes. So, right away you can decrease your risk for a coronary event by quitting smoking, by planning to exercise, and then improving your dietary habits. What are those dietary habits that can be so detrimental to the coronary vessels? Let's talk about trans fatty acids. And I'm sure you've heard of those. Trans fatty acids, when you read your labels, and we hope you are reading your labels when you go to the store, you do not want to eat food blindly unless you know it's an apple and you see it's an orange. That's pretty safe. Otherwise, read your labels so you know what you're ingesting into your body. Trans fatty acids, otherwise known as partially hydrogenated oils. When you read your labels, it will say partially hydrogenated soybean, corn oil, or whatever oil it is that's been partially hydrogenated. It changes the structure, and those trans fatty acids, when they are ingested and they get into the cell membranes all over our body, including the coronary artery cell membranes, they cause a distortion that is more likely to attract those clots, those platelets, causing more damage to that endothelial lining. Read your labels. Avoid trans fatty acids like the plague. Where do you find them? Cakes, pastries, baked goods, those things that can sit on the shelf for 50 years without going bad. Those have the partially hydrogenated fats in them, and those you want to avoid. What else in your diet? Well, of course, fruits, vegetables, and whole grains give nutrients that cause health and regeneration to the endothelial lining and to the coronary vessels. We want you to eat fruit, vegetables, whole grains. Ideally, to be a vegetarian, you would have less heart disease than you would if you were a meat eater. What is in meat that is so damaging to the vessels? Not trans fatty acids. Trans fatty acids, we find them in vegetable products, and they're damaging. In meat, we find the saturated fats that you find in the steak and the marbled meat and the skin, of chicken. These saturated fats are damaging to the blood vessels. The Institute of Medicine has said there is no safe upper level of normal for trans fatty acids. Basically, avoid those. For saturated fats, depending on your risk assessment, if you're at high risk, it may be that you have to completely avoid them. If you're at low risk, then occasional use, may be permitted without detriment. Ideally, again, we want you to have a plant-based diet. Fruits, vegetables, whole grains. So, the things that we eat, toxins that are ingested, such as caffeinated products, can also affect the heart and the nutrients. If your diet consists of chips, soda, Krispy Kreme donuts, well, that is a vegetarian diet. And I'd have to say it's also plant-based. But it's not going to give you healthy coronary arteries. So we do have to look at the big picture. We have to avoid things that are bad and include things that are good. Fruits, vegetables, whole grains. Lean meats if you're going to eat meat, depending on your risk assessment. So coronary artery disease is a marker not only for conditions in the heart, but in other areas of the body. You may suffer from cramping in your legs when you walk. That tells you that the same process that may be going on in the heart is going on in the legs. Erectile dysfunction in males can also be a marker for coronary artery disease. And so if you suffer from this condition, do not simply get a medicine to mask the condition. You need to have a thorough cardiovascular workup, or else your first manifestation of coronary artery disease may be sudden death, and that would be very unfortunate. So we want to implement, if possible, primary prevention and secondary prevention. Secondary prevention means that we want to try and find a disease when it is asymptomatic. We want to get that coronary artery disease before there is an event. Primary prevention means we want to prevent coronary artery disease occurring in the first place. So you can see that the coronary equivalents, diabetes and chronic renal disease, already tells us that most likely coronary artery disease is present. And so in individuals like that, we have to be very aggressive with diet, with exercise, tobacco smoking. We'll even look for markers in the bloodstream that you can check with, by getting blood drawn, looking for something called cardio-CRP, or C-reactive protein. That tells us about the inflammatory state of the bloodstream. So it's not enough just to know the levels of your cholesterol, although they're important. We need to also know how is your bloodstream behaving? Is it inflammatory? Is it likely to stick? A large study done actually in women showed that exercise regular exercise decrease the C-reactive protein to safe levels. And so in my patients, as part of my coronary risk profile, not only will I get a family history and a personal and social history about smoking, etc., we will check a fasting lipid profile and their blood glucose, but also we will check their cardio-CRP, as well as their cardiac homocysteine, which is also a marker not only for coronary disease, but also for cerebrovascular disease. So we want to look at a variety of markers to assess the risk. Once the risk is assessed, that will determine just how aggressive we will be. If you are found to be in the high-risk categories, aspirin is recommended to be taken, just a baby aspirin. More is not better. Taken 2 and 3 regular aspirins simply increase your risk for hemorrhagic stroke and gastrointestinal bleeding. A simple baby aspirin, if you're at high risk, would be very useful for you. If you're at low risk, it's no help at all. Again, medicines only complement the lifestyle factors. It's the lifestyle factors that are the foundation for the management of prevention and treatment of coronary artery disease. The recent Women's Health Initiative study addressed hormone replacement therapy. It was thought that this was important for women to prevent them having heart disease, and that is found to be false. And in fact, hormone replacement therapy may in fact increase the risk for coronary artery disease. So if you are taking hormone replacement therapy to decrease your risk of coronary artery disease, that is not the reason to do that. And we would suggest that you go back to your physician and have a discussion about the reasons for using hormone replacement therapy. And so, what are the steps for prevention and treatment of coronary artery disease? You need to see your physician so that your risk can be assessed using the global Framingham scale. And once your assessment of your risk has been done, then we can implement lifestyle guidelines to prevent an event occurring, such as sudden death or a heart attack. And so we are truly fearfully and wonderfully made. The Lord has made our coronary vessels so fine that there are simple things that we can do to keep them clear. I wish above all things that you will prosper and be in health, even as your soul prospers.